The gentleman from Tennessee is recognized.
Thank you, Mr. Speaker. I yield 5 minutes to the sponsor of this legislation, gentleman aware of law enforcement's importance, and Mr. Trone of Maryland.
The gentleman from Maryland is recognized for 5 minutes.
Thank you, Mr. Speaker. I rise today to urge my colleagues to pass our bill, the Public Safety Officer Support Act 2022, so that we keep tackling mental health stigma across this country. It's been almost 3 years since Montgomery County Officer T.J. Bomba passed away from suicide. He was 38 years old and left behind a wife and 2 sons. In the aftermath, immediately, we brought together Officer Bomba's colleagues and the head of NIH Mental Health, Dr. Joshua Gordon, and others to chart a course of action. We discussed access to care and the stigma surrounding mental health and how we could be advocates for change. The roundtable produced 2 calls to action: increasing peer counseling support opportunities for mental health and provide parity in benefits for mental health conditions. I made a promise that day to do everything I could to turn these ideas into law. 6 months ago, we accomplished one of our goals when I stood alongside Officer Bomba's wife and 2 sons as President Biden signed the first of our 2 bills into law. The Cops Counseling Act increased access to peer support. It will help fight stigma and improve access to mental health services. Today, I stand here to applaud the passage of our second bill, the Public Safety Officer Support Act 2022. According to the research from the Substance Abuse and Mental Health Service Administration, public safety officers are 25 times more likely to develop acute stress disorder, post-traumatic stress disorder, or other mental health conditions than our general public. And the conditions often go untreated due to the stigma of health. As it stands, mental health is excluded from the PSOB program. If an officer is killed in the line of duty, the family is eligible to receive benefits. However, if an officer dies by suicide that's directly tied to their job, the family is unable to seek death benefits. This bill will address the issue of stigma and provide the overdue parity between physical and mental injuries. Officers who are totally disabled as a result of their service will have access to disability benefits. The families of officers who pass away from service-linked suicide will have access to death benefits. This approach has been endorsed by numerous mental health organizations, including the American Foundation for Suicide Prevention. With the help of the public safety officer community, mental health experts, and my colleagues in Congress, I'm proud to bring this piece of legislation before the House. Thank you to everyone who joined the roundtable in 2019. We've taken a tragedy and turned it into actionable solutions. Thank you to all the stakeholders who've worked hard to bring this legislation to the House floor. I appreciate the hard work. And thank you to Congressman Reschenthaler for co-leading this bill, for helping us give it strong bipartisan support. Thank you. I yield back.
Gentleman yields back. The gentleman reserves.